The CRAFFT is a gold standard substance use screening tool. There are many validated screening tools available that ask about a variety of substances. Some tools focus on one substance, such as alcohol, and others focus on multiple substances. It may be more efficient for practitioners to use a tool that screens for multiple substances simultaneously rather than using a single tool to assess use of a single substance. This can provide the practitioner a picture of risk across multiple substances at the same time. Regardless of the screening tool used, asking about substance use may be especially difficult with adolescents who may not want to disclose or discuss their use. Successful screening can be enhanced by the memorization of the tools and practice of the conversation skills required to put the adolescent at ease. Whatever the tool and method of administration, introducing the conversation about substance use and screening is a good skill for any nurse, social work, medical provider, school official to practice in order to naturally transition into the suggested tools in this module. The literature also suggests that self-administered computer screening is valid and time efficient for adolescents, and that some may actually prefer this method. So how to discuss substance use with the adolescents is so very important. Practice the following conversation to introduce the topic of substance use with adolescents. To start, for example, you could say, in order for you to get the best services, I'd like to ask you some questions about your health that I ask everyone. These questions will help me to get to know you and provide you with the services you may need. Is that okay? So that's an example of a permission statement. Or, as a way to help me get to know you, I'd like to ask you some questions that I ask everyone. Is that okay? So these permission statements are made to put the person you're talking with at ease, that they have some say in what is happening. If they question why you're asking about them, the substance use, you could respond with, I ask everyone about their use of alcohol, tobacco, marijuana, opioids, and other substances. It helps me better understand your concerns and the things that may come up in any work we do together. The information you tell me is confidential. I will not disclose your answers to your parent unless you want to include them in our conversation. Once they consent, you may say, now I'm going to ask you some questions about your use of various substances during this past year. Confidentiality can play a vital role in providing health care to adolescents. Research has shown that adolescents who are aware of confidentiality are more willing to seek health care compared to their peers who may not have the same awareness. State laws govern minor patient rights to confidentiality of information shared with healthcare providers about substance use, but states vary as to whether or not a minor can confidentially receive substance use treatment services. Also, you should explain the full confidentiality policy regarding the disclosure of sensitive issues directly to the adolescent at the very beginning of the assessment. If the adolescent is willing, it can be helpful to explain the confidentiality policy to both the adolescent and the parent or guardian at the same time. An example of how you might convey an assurance of confidentiality is by saying, everything you tell me will be confidential unless I hear that you're harming yourself or someone else is hurting you. I'll keep our conversation about your substance use between us unless you agree to include your parents or guardian. Do you have any questions for me about confidentiality and its limits? Here's another example of how to discuss confidentiality. Thank you for completing the form and for your honesty in it. I'd like to tell you about our confidentiality policy. I'll keep the details of what we discussed today confidential, which means I won't share anything with your parents. The limit of the confidentiality is safety. So if you tell me something that makes me think you are at risk of hurting yourself, hurting someone else, or someone is hurting or abusing you, I would have to share that information with the proper health officials to make sure everyone is kept safe. Do you have any questions about how that works? There are different steps that you can take to ensure confidentiality, and those include establishing a private time for screening and a private time for discussing the results, keeping follow-up visits confidential, talking about referrals, discussing procedures that may break confidentiality inadvertently, and clarifying risk of releasing medical records are all important conversations to have at some point. Substance use screening questionnaires can be verbally administered by a staff member or a practitioner, or self-administered by the adolescent using paper and pencil or electronic devices like smartphones, tablets, or computers, depending on the screening tool. There's no one correct approach that suits all settings and situations, but there's several considerations that may favor one approach over another. Self-administered screenings by the adolescent may save time and be most efficient because different members of a care team, such as front desk personnel, medical assistants, can initiate screening as part of the check-in process. That is, the adolescent could complete self-administered screenings in a waiting room, exam room, or other space prior to meeting with the practitioner if it's possible to create a sense of privacy. With self-administered screenings, it's important to inform the adolescent and the parent or caregiver, if present, that the adolescent should complete the form on their own. The practitioner would then review and verify self-administered responses during the visit. Adolescents may feel more comfortable and provide more accurate responses using self-administered brief screening due to the sensitive nature of the topic. Electronic screening with privacy screens may be especially ideal because of the sense of privacy it confers. With the widespread adoption of digital communication, studies have shown that adolescents may be more likely to self-disclose using an electronic device. Screening tools have been tested using the specific wording, and any deviation from the original wording may alter the type of response given by the adolescent. To ensure accuracy, it's important to ask the question exactly as they are written. However, you may further elaborate and explain the question if the adolescent does not understand the question as it is written, which we discussed in a previous presentation. When an adolescent is responding to screening questions in a language other than English, self-administered screening may also be more feasible and efficient. Many tools are available in multiple languages. However, when there's concern about reading comprehension or literacy, staff or practitioners must be more involved to assist the adolescent and may need to administer the screening tool verbally. The CRAFFT family of tools are the most popular substance use screening tools for adolescents 12 to 21. It's recommended by the American Academy of Pediatrics, Bright Futures, for use in preventative care screenings and well visits. These tools are designed to ask age-appropriate questions about problems related to alcohol, drug, nicotine, and tobacco use, and screen adolescents for lifetime substance use disorders simultaneously. It's brief so that it can be easily integrated into routine care. The CRAFFT tools have been extensively validated. A score greater than 2 indicates risk of a substance use disorder. However, because they ask about problems related to all substances simultaneously, they cannot be used to determine which substance is the source of the disorder. The original CRAFFT tool was released in 2002, and the Center for Adolescent Substance Abuse Research has updated it since then to create a more streamlined and easier to understand process of self-reporting and to better represent substances of use and methods of administration by adolescents. The CRAFFT developers are strongly encouraging practitioners and organizations to move from the original to a higher version. These versions take advantage of improved psychometrics and how the tools gather information about a fuller range of substances, so it leads to more accurate screening of adolescents. However, if circumstances do not currently allow for this shift, perhaps to it being incorporated into the work-through or electronic medical record, each version of the CRAFFT is still valid. And you can find those at CRAFFT.org. Most versions have been translated into several languages, and the Learner's Guide contains the most recent version in English and Spanish. So we welcome you to explore these as well. Even though the CRAFFT has been updated a few times, the modifications did not affect the overall structure of the tool. All versions contain two parts, Part A and Part B. Part A determines if the adolescent has used any alcohol, marijuana, or drugs, and now tobacco and nicotine in the past 12 months. Part B asks about the adolescent's experience with alcohol and drugs. Part A has been slightly modified over the years, while Part B has remained exactly the same. Finally, Part C has been added to assess nicotine and tobacco dependence among adolescents. All versions of the CRAFFT may be administered via interview or self-administered either electronically or in paper form. One significant change is that Part A now incorporates opening questions inquiring about the frequency over the past 12 months of use of alcohol or other substances, in place of the previous opening questions that ask yes or no questions about prior use. This enhanced the item's specificity and is intended to allow the practitioner to better understand which preventive measures to employ and or which interventions or treatment options to offer. A study examining the validity of these opening yes/no questions found relatively low sensitivity in identifying youth with any past 12-month alcohol or marijuana use. Research suggests that yes/no questions about sensitive topics may have greater potential for motivated underreporting and social desirability bias than questions that how many or how often, which implicitly convey an expectation of the behavior. Therefore, the opening questions were modified to ask about 12-month frequency on how many days and includes instructions, say 0 if none, to also normalize non-use. Item validity was tested in a screening study of adolescent primary care patients. Compared to the criterion standard of a research staff-administered confidential timeline follow-back interview, the results showed that the frequency questions had improved sensitivity in identifying adolescent substance use compared to what was found for the yes/no questions. For the opening question, the highest sensitivity is preferred to avoid missing anyone who may be at risk. Another significant change includes a new question about the frequency of tobacco or nicotine use in the past 12 months, and rephrasing of each question in Part A to offer the adolescent more clarity and examples of products and methods of administration, in particular regarding marijuana, tobacco, or nicotine use. And finally, the most significant change is the addition of Part C, which incorporates 10 additional items from the Hooked on Nicotine checklist that can be administered to further assess nicotine and tobacco use. This version is referred to the CRAFFT plus N 2.1 HONC, which includes all of the updates described above. So please be looking to see which version of the CRAFFT you're using and use these that are more specific and to substance use. The practitioner can choose to administer only Part A and Part B of the CRAFFT plus N. However, if they want to conduct a further assessment of nicotine and tobacco use, then Part C can also be administered. When administering the CRAFFT plus N 2.1 via interview or self-administration, you should begin by saying for self-interview, say, I'd like you to complete this form that includes a few questions that I ask everyone. Please answer these questions honestly about your possible use of substances. Your answers will be kept confidential. For the interview, I'm going to ask you a few questions that I ask everyone. Please answer these questions honestly about your possible use of substances. Your answers will be kept confidential. Then start by asking 1 through 4 in Part A, which asks about the frequency of past 12 months use of alcohol, marijuana, and other substances, including nicotine and tobacco. You'll have the option of using the fourth question here and including the HONC in the future. However, we will be practicing using the basic CRAFFT as you participate in the workshop training. If the adolescent reports any use on Part A, all 6 questions in Part B should be asked. If they answer 0 to questions 1 through 4 in Part A, only the car question in Part B should be asked. If the adolescent reports using a vaping device containing nicotine and/or flavors or any use of tobacco products in question 4 on Part A, all 10 questions in Part C should be asked. The 6 questions in Part B create the CRAFFT mnemonic acronym, where each letter represents a keyword in each question. In this way, it's easy to remember and apply in the field and do so consistently across every version. If you've ever ridden in a car, so relax, alone, forget, family, friends, gotten in trouble. So those keywords will help you as you learn to memorize these questions. The 10 yes/no questions in Part C are from the Hooked on Nicotine checklist. The Hooked on Nicotine checklist is used to determine the onset and degree of tobacco dependence. It's designed to identify the point at which an adolescent has lost full autonomy, either physically or psychologically, over their tobacco use. It also identifies adolescents for whom help and encouragement with cessation would be appropriate. The questions in Part A are not scored, but instead indicate which questions in Part B to ask, either only the car questions or all 6. Mhm. Each yes answer from the adolescent for any question in Part B scores 1 point each, and a no answer scores 0. Tally the points accrued in Part B to obtain the final score. 0 to 1 indicates that the risk of substance use is low. 2 or more indicates it's a more significant problem. However, the 2+ cutoff score is not a hard and fast rule, whereas most of the research on the CRAFFT has indicated 2 or more as the optimal cut score. Some research suggests that 1 or more or 3 or more may be a better cutoff. However, since the CRAFFT serves mainly as a screening tool, it's best to favor a cutoff score that minimizes false negatives. In other words, go ahead and choose the lower score compared to false positives, which are identifying a student as having a problem when they don't. Thus, using the 3+ cutoff score is not recommended as a routine policy. 2+ cutoff is favored given the weight of research evidence, and opposed to setting the cutoff score lower than 2. This recommended score provides a good balance between hits and misses and means that you can be reasonably assured that an adolescent who scores in this range is likely to be appropriate for brief intervention. But if an adolescent scores 0 or 1, and you have additional red flag information about their use, then a brief intervention may also be indicated. Screening tools, including the CRAFFT, do not provide definitive information. Use of the CRAFFT should proceed with caution and with the recognition that other information may be used when determining the suitability of a brief intervention or need for referral for an adolescent. A complete description of the CRAFFT scoring instructions are available again in Appendix A. The brief counseling approach is easy to remember and to use. It is covered in more depth in the CRAFFT 2.1 manual found on As You Learn in greater detail, including example scenarios. Brief intervention is also covered in more detail in Module 2. Remember that it's the 5 R's: review, recommend, risk counseling, elicit self-motivational statements, and reinforce a person's own autonomy and self-efficacy. Here's some key points. Screen everyone. Screen both alcohol and drug use, including prescription drug abuse and tobacco. Use validated tools. Pre-screening is usually part of another health and wellness survey. Explore each substance. Many people use more than one. Follow up positives or red flags by assessing details and consequences of use. And use your motivational interviewing skills and show non-judgmental, empathetic, verbal, and nonverbal behaviors during screening. So here's the summary. It's the first step of the SBIRT process and determines the severity and risk level of a person's substance use. The result of a screen allows the provider to determine if a brief intervention or referral to treatment is necessary next step for the person in their care. The clinician has valid patient self-reported information that is used in the brief intervention, and often the process of screening sets in motion the person's own reflection on their substance use behavior and can be a powerful method for behavior change.